And we are back with more What's Now, focusing on heart disease and strokes. In fact, the American Heart Association recently released findings to a study they did this year, all about what you need to know with heart disease and stroke right now. Specifically, it's still the #1 killer for women, and also very much a concern for new moms as well. Let's take a look.
Cardiovascular disease remains #1 killer of all women and the leading cause of maternal mortality. American Heart Association's 2022 Heart and Stroke Statistical Update highlights the need for greater awareness for women and new moms. And today I have American Heart Association medical expert Dr. Monik Jimenez here to share important findings from this newly released statistical update. Dr. Jimenez, thanks for joining us today. How are you?
Great. Thank you for having me.
What were some of the key findings from the 2022 Heart Disease and Stroke Statistics Update?
Sure. The American Heart Association 2022 statistical update shows that cardiovascular disease continues to be the #1 killer of women in the United States. And we also know that 44% of women who are 20 years of age or over are living with cardiovascular disease. There's also a new important section in the report about adverse pregnancy outcomes. And we can think of pregnancy as nature's stress test for women. In the US, there are growing rates of illness and death related to pregnancy disorders, and the majority of those are cardiovascular disease. So, for example, hypertensive disorders of pregnancy and gestational diabetes.
Why is cardiovascular disease still the #1 killer of women, including new moms?
Yeah, what we know is that cardiovascular disease can impact any woman at any time during her life. And it impacts some women differently than others and in different ways. So, for example, in the United States, over the past 30 years, the maternal mortality rate has increased by 140%. And so there is still a lot of work that needs to be done. And one of those is to increase awareness of cardiovascular disease among women. So, for example, we know that women are not little versions of men. In fact, they have unique biology. And so it's important for women to understand that there are specific aspects of their life course that can impact their risk of cardiovascular disease.
So, what exactly is being done to increase women's heart health awareness?
Well, we're not just talking about women's heart health awareness today, but this is a movement, and we are engaging with community members, we're engaging with organizations, and working on increasing education to give one very clear message that cardiovascular disease is the #1 threat to women's health. But the good news is that there's a lot that we can do. In fact, most of cardiovascular disease, heart disease, and stroke can be prevented through education and healthy lifestyle changes. And this is an important message for women to understand so that they can be aware of the factors that they can, work on to improve their cardiovascular health.
How can women take action for better heart health today?
Well, I have 3 recommendations. And the first is encouraging women to know your numbers. So that means know your own personal cardiovascular history by knowing your family history of cardiovascular disease and your personal health numbers. So your blood pressure, blood glucose level, and your body mass index. In addition, we want women to make health a priority. And so we're encouraging women to engage with us in the Reclaim Your Rhythm movement, which asks women to make one simple change to a healthy habit that they might have lost over the past couple of years. So increasing activity, or for example, engaging in more self-care. And we also need to increase the representation of women in cardiovascular research. By investing in women's research, we invest in everyone's health.
And where can we get more information?
Please visit goredforwomen.org.
Thank you so much, Dr. Jimenez, for joining us today. Really appreciate this important information about cardiovascular disease and women. Thanks so much for your time.
Thank you.